why is there so much misconception of stem cells? Like you're seeing, a lot of not good things being said about stem cells, but then on the other hand, you're seeing a lot of great things. Like I saw just the other day, how they just realized that by utilizing stem cells, they can grow another heart. I mean, that's unbelievable. I mean, and that's actually proven. But what I'm seeing, correct me if I'm wrong, that it's almost kind of cliche. What is good has become bad, or it's like when there's good on the internet, there's always bad trying to say, and it doesn't work. And then you're seeing people walking and being healed. I mean, what's going on? What would you say? How would you answer something?
I think that there's a lot of misinformation out there, and unfortunately, a lot of it's being put out by people in the field, actually, competitors doing slightly different things, right? So I think that in my experience, I mean, compared to steroids or any other treatment that's out there, this stuff really does work, and it really is utilizing, your own healing property. It's telling these dormant stem cells to wake up, and it's providing what I like to call a moat around the joint, say, that you inject, and it's saying all the inflammatory stuff stay out, and that's what these new stem cells are doing. So yeah, I think there's just a lot of misinformation out there. I think that the first generation of regenerative medicine was using bone marrow or adipose tissue, and I think that is still around, but you're still using your own cells that are, say, 50 or 60 years old, instead of using, cells from an umbilical cord from a healthy baby that was donated and then sterilely used in a vial and then injected. So do you want the 60-year-old cells, or do you want the one-day-old cells? I think most people are going to say, give me the one-day-old cells. And then that's moved on to the second generation of regenerative medicine, which is what we're currently doing, which is umbilical cord or placenta or embryonic base. They're all synonymous cells. And then I think that we're just entering in the third generation of regenerative medicine, which is something called exosomes, which is actually the secretions of the cells, which you need an electron microscope to even see. So we can get billions of these in one milliliter of an injection. So it's pretty amazing stuff, Mark. And I think that I strongly feel, and I felt for the last even 7 years, that this is the new wave. I mean, this is what everything's going to, and I really think it's really cutting edge stuff. But I think that it's now being made available to more and more people.